Here we are. It is Health Talk, another exciting edition, and we have our good friend, actually a gentleman who's been on the show before, Dr. Tim Richards from Community Medical Center and Rocky Mountain Surgical Solutions. Welcome, sir.
Good morning.
How you doing?
I'm doing superb. Thank you.
All right. So now for those who missed the last time you were on, let's talk a little bit about Dr. Tim Richards. Give us a little bit of your background, training, and how you got to Missoula.
Well, essentially, it's one of those things that I was a military surgeon for 12 years of my life, trained and raised in the military. Actually raised as a military dependent, but I trained with the military at Letterman Army Medical Center and spent 12 years in the military, my last duty station being down in Colorado Springs at Fort Carson. I was over in Europe with NATO, and I was somewhere in southern Iraq during Desert Storm, and then I was Yugoslavia with that, and then came back to the United States and moved up here in 96, so this is year 20 for me here in Missoula.
Wow, cool. Now, when you were overseas, you're obviously functioning as a physician, right?
Correct.
So what was it? Was it a general physician? Were you a battlefield surgeon? What?
I was an Army surgeon, so I was part of in Desert Storm. I was part of a forward surgical team. So it was the whole concept of forward surgical teams was brand new, and so we were able actually to move along with the troops as the flow of battle went forward, operate. And we were able to set up a 2-bed operating room and a 7-bed ICU within 3 hours out of 2 tents, and actually operate in those and take care of forward battle injuries, and then be able to ship them back very quickly. Because the MASH units just weren't able to keep up with the flow of battle. Things happen very quickly now. So I was part of these forward surgical teams, and then Yugoslavia, I was the chief of surgery for the first unit that went down there for that.
Wow. So you dealt with a lot of emergent care.
Yes, sir.
Is your work back in the States quite a bit different? I mean, how do you transfer that kind of skill?
It's quieter, thank goodness, than that. We don't, but it does transfer a lot. I mean, because taking care of folks, but I would say that, taking care of troops is still one of those things that's just was an absolute honor. And in more ways than one, it's one of those things, taking care of those guys, they just don't get enough care.
Wow.
All right. So you are here today, though, to talk about Rocky Mountain Surgical Solutions. And one of the things we want to talk about, I know isn't very sexy to talk about varicose veins, but a lot of people have them.
Yep.
There are a lot of people out there that, like John and me, I spend the entire day on my feet, okay? Very rarely get a chance to sit down. And there are folks who are working out like at Costco or Walmart or whatever. They're on their feet all the time, and they get varicose veins. So if you would mind just a little bit of Dr. Dummy here, if you would just mind describing what exactly that condition is.
Sure. So varicose veins, what people identify as varicose veins is the big ropey things that are big, balloons on your legs that you get. And mostly what that is a cause from is leaky valves in the veins that are deeper. So the valves in the veins are kind of like a check valve in an engine. What it does, it keeps blood flowing back to your heart. And when you're on your feet for a long period of times, or you've had babies or whatever that's increased pressure in your abdomen, what happens, those valves can break down. And so if those valves break down, that check valve is no longer there. The blood backs up because gravity does its job. You're on your feet all day, so right. Gravity keeps that blood pooling in your legs. And then those little branches balloon up, and that's what you see as a varicose vein. And they can be symptomatic. They can ache. They can hurt. They can be tender. You can get heaviness, tiredness, itching, all those because of these leaky valves.
So you said if you had a baby, what if you had a sympathy baby and gained a couple extra 100 pounds? Does the extra weight add to the likelihood of getting varicose veins?
Absolutely, yeah. Obesity is a major cause of varicosities, you bet.
What does the word even mean, varicosity, varicose veins?
Well, in Louisiana, they call it very close veins. But essentially, it's just the broken down part of the wall. But yeah, so you have these very close veins down in Louisiana.
Got it. So if I don't go to Louisiana, I should be okay.
You're good, yeah.
A little bit too closely related, maybe, yeah? Yeah, or something like that. I don't know. But now let's talk for a second about when you have these large veins, are they more... You have a tendency, if you get a scrape or a cut, that you could have a bleeding event?
Oh, absolutely. And we see quite a few people with that, because what happens is when the vein gets very close to the surface, and sometimes it doesn't have to be the big balloony type, it'll be maybe just a little tiny blood vessel because of that pressure, that excess pressure down there. It'll bleed, and we've had people who all of a sudden just spontaneously bled in the shower. They equate it to gutting an elk. Kind of thing that this shoots across the shower. I mean, it's being very graphic on the radio. Sorry, but it's one of those things that it can be quite tremendous. So when that happens, obviously that something needs to be fixed.
Sure, yeah. So now, in years past, how were varicose veins treated? I know people wore tight stockings and that sort of thing.
Well,
right?
so many years ago, it used to be one of those things that they wouldn't do anything about it. Then for probably the past 60, 70 years, we've stripped veins, where what we do is we would actually go in. It's an operative procedure. They put you to sleep. We cut down the groin, tie off where the vein goes into the main vein, and then you'd pull that entire vein out of your leg. It's kind of a miserable procedure. It's called a vein stripping.
Wow.
Miserable procedure because it hurt. You're off your feet for a week to 2 weeks. It's like I equate it to people. It's like hitting your leg with a baseball bat.
Wow. And so at what point somebody had to say, there's got to be a better way to do this, right?
And so now we're doing what's called an intravenous procedure, where actually we're using a heating device, either laser or radio frequency, where we put a catheter up that vein. And what we can do is in our office do a procedure where we can actually kill the same vein that we used to strip. We can destroy that vein with heat, with very minimal to no discomfort to the patient, and they can walk in and walk out.
Is there a negative side effect to losing the vein?
No, there's not, because, mostly that vein's not working anyway. So because it's all varicose and not working to begin with, it doesn't matter to lose it. It's not a vein that you would use for not for heart bypass or anything like that, because it's varicose. It's not good. So losing it causes no problem.
So does the body then, if it finds that blockage, does it create a new vein, a new way for blood to get where it needs to go?
Yeah, the two veins that we actually treat, for the most part, only represent 5% of the return back. And so you have hundreds, if not thousands, different ways that your blood can get back.
Okay. Well, we have Catherine on the line. Let's go ahead and get this call on. So, Catherine, you're on with Dr. Tim Richards. Hi.
Hi. I just wanted to ask,
hold on. Hang on just a minute. He's not getting you. Please stand by.
Okay.
Now I'm plugged in.
Okay, now you go. Go ahead, Catherine.
Okay, yeah. I wanted to ask you, is there a relationship between varicose...
Go ahead. Yeah.
Okay. Now I can go?
Yes.
Yeah, you had robotic voice syndrome for a second there.
Go ahead.
Uh-oh. Okay. I wanted to ask if there is a relationship between varicose veins and aneurysms, and if an aneurysm occurs within the core of the body, is it the same thing as a varicose vein?
Usually when you're talking about aneurysms, you're talking about arteries, not veins. Right. So it's two separate systems.
Okay. So, but can you get varicose vein or varicose arteries, if you will, in your legs too, or?
Yeah, you can get aneurysms in the arteries in your legs, but that's different than varicose veins.
Okay, are they treated the same then?
No, they are not. So aneurysms are treated, nowadays they're doing a lot of that endovascularly. That's either done by the vascular surgeons or the radiologist, and so that's actually a different procedure for aneurysms. But quite a few of those actually require operations, but that's a whole different thing than venous problems.
Okay, I'm kind of curious as to why. I don't know whether you want to address that, but why those would be treated differently in the leg. But okay, thank you.
All right. Thanks for the call. Thank you, Catherine. Appreciate that. Hey, we're up against a break, 721-1290. You have a question for Dr. Tim Richards. He's joining us here in studio from the Rocky Mountain Surgical Solutions, talking about varicose veins and some of the new techniques of treating that. It's much, much faster and less painful than the old procedures. If you want to ask him a question, he's here to answer your questions free. It is free, right? Okay, well, we're not going to charge you. 721-1290 is our number. We're coming right back with more Health Talk in a moment. You have to really think hard to go around the barn for this one, but this is a song called Legs, so I thought it'd be pretty appropriate to talk about Dr. Richards. He's looking at me like, who is this guy? Anyway, 721-1290 is our number. You have a question for Dr. Timothy Richards. Now, you had just mentioned you had a very exciting event at Rocky Mountain Surgical Solutions, and that is your 100th robotic surgery, right?
Correct. Yeah, actually, so we do this at Community Medical Center, and I want to, really congratulate our robot team there. So we do robotic inguinal hernias, and they really do a fantastic job. So we've now 3 weeks ago now, we did our 100th robot inguinal hernia repair, and it really, I think, is going to revolutionize inguinal hernias. Seriously, it's the cat's meow.
Well, you told me a story when we were doing some commercials for this that I had a hard time believing until I actually talked to the guy about the guy who had the hernia surgery and then like a day or two later went elk hunting.
Yes.
Could you relate that story?
Yes.
Elk is coming up a lot today.
Yeah, I know.
There's
More metaphors, please.
Yeah.
Well, so we had one gentleman. We do these usually on Fridays is when I have my robot time, but we do them throughout the week. But did his case on Friday, and that Sunday he got his bull elk backcountry and was able to cart it out. And so it's one of those things that doing these in the open fashion, which I've done for almost 30 years, it's one of those things that you wouldn't be able to do that way. The robot has allowed people to get back to work. We had another guy who, we did his hernia on Friday. That afternoon, he took his dog out for a mile walk and then did a cross-country ski race on Sunday. And like we've done over 100 now, but out of that 100, I can sit there and say that about 90 of those patients actually can do that kind of stuff. There are some who have some pain afterwards, but nowhere near compared to what it was with the open repair. And they're actually getting a better repair.
Wow. So you say robot, and lots of different pictures come to people's minds. Like, I think of C-3PO. I'm sure other people have different expectations for robots.
Please hold still.
What does your robot look like?
This is where you key up the Mr. Roboto music. It's actually one of those things that nowadays folks all come into the office having Googled, Da Vinci robot or robot hernia repair. You can go online and see what it looks like. But it looks very similar to a spider or an octopus. It has these multiple arms that come off of it. And this is what we hook up to the patient. And then I actually go across the room in a what we call a console, stick my head in, and then take control of the robot. And like I was telling you earlier, that's one of the things where a lot of people think the robot's doing everything. No, I'm actually in control of the robot at the entire time.
It's the man behind the curtain.
Yeah, pretty much.
So is it kind of like operating a crane or something? I mean,
yeah, but those guys are a lot more skilled than we are. But
Whoa.
But no, it's interesting is because the learning curve. So we've done laparoscopic surgery for a long period of time, but the robot actually is easier than laparoscopic surgery because you're using all the same movements that you use with your hands. You're doing pretty much the same thing as if you were doing it open, but you're using the machine to do it very more precisely.
But you as the surgeon, when you're actually doing it, like there's resistance and there's pressure and weight, and I imagine a lot of other things that you can use to kind of judge where you're going. I don't know. I haven't done what you've done, but I have gutted an elk before, so I know a little bit about cutting things up. So I guess my question for you was, is it when you're dealing with the robot, I mean, I imagine there's not as much give. There's not as much pressure. You got to kind of relearn how to do everything.
Well, not really. I mean, it's one of these things that what we call visual cues. What you're talking about is being the tactile feel that you get with using your hands.
Yeah.
And that's been a lot of concerns, and the company that have developed all this stuff have done quite a bit of work on doing that. But you learn visual clues when you're looking at it, because we're looking at this in 3D. And I'd actually invite you guys to come over and take a look at it because it's slick.
3D?
I mean, yeah, it's actually all 3D vision. So you're kind of inside of the patient when you're doing this. So you get visual clues when you're handling the tissue, and with the instrumentation, you actually grab a hold of the stuff, and you can see how tight or how much you're holding it.
So can you see how deep the skin level is? Can you see where the organs are? And
stuff?
Absolutely.
It's actually better vision, in all honesty, than you get looking at with your own two eyes.
Okay, in all seriousness, can I bring an elk to your lab and practice?
Well,
see what it's like?
I don't know about the elk.
How about a hamster? An elk is a little big.
Probably wouldn't be good to leave the guts in there all that time anyway.
I'd truly invite you over to come take a look at it because, I mean, we love to show it off. I mean, it's one of those things that just so people understand it.
There was an old science fiction movie years ago back in the 60s called Fantastic Voyage.
Oh, yeah.
Where they shrunk that little thing down and they had to go in to take care of an aneurysm or a blood clot or whatever. And it sounds to me like that's kind of what you're describing, and that you're right there in the middle of all this stuff, seeing things as they actually are. And this is not just a representation. This is exactly what's actually in there, right?
Exactly. Yeah, and it's... Like I said, what it does is the instrumentation and stuff makes it so that that the amount of trauma that's happening to the skin is less. That's why it doesn't hurt. I mean,
okay, let's get Joe on the line. Joe, you're on with Dr. Richards. Go ahead.
Yes, Doc. Does Hillary Clinton have varicose veins?
I have no idea.
No, what do you think about that? All this talk about her health.
What do I think about that? Well, I'm not here to be a politician this morning, but it's one of those things that I think anybody's health is a matter of their own personal opinion. But at the same time,
Thanks, Joe. Thanks for the call. Okay. Anyway, so one of the things that you mentioned is that you said that this repair that you're doing with the robotic surgery is actually a better repair than the previous one. Why is that?
Well, when we do the open repairs, it's one of those the coverage that you get posterior to the hole. So what a hernia is something poking through a hole it's not supposed to poke through.
Right.
Okay. So when we are doing these open repairs, we do put mesh posteriorly or behind the hole, but you don't get the amount of coverage. And then some people are actually just putting a patch over the top. Well, if you think at it from what we call a physiological standpoint, most of your pressure is coming from inside. If you're pushing from inside and you have just a cover on the outside, you can blow that out.
Right.
Or if you have just small coverage on the inside, you can blow that out. But when you're putting a big piece of mesh around that hole posteriorly, there's no way you can blow that out. I mean, you can't create enough pressure to do it. And so the laparoscopic repairs that we have done for a long period of time, people do that, is actually a little bit more expensive to do just because you have to use tackers and all these other things, and it hurts because those tacks hurt. With the robot, we just throw some stitches in, and that's it.
Well, we're gonna take a break. We'll come right back. If you have a question or comment, the lines are open. Dr. Richards will be here for about another 8 minutes. So if you have a question or comment, give us a call at 721-1290. This is Health Talk. You asked for it, Dr. Richards. Here it is. I found Mr. Roboto for you. There you go. All right. Dr. Tim Richards joining us here on Health Talk. And let me just get the phone going. Ford, you're on with Dr. Richards. Go ahead, sir.
Oh, yes, Dr. Richards. I would just like to know what is the cause of edema, water buildup in the legs?
All right, there's actually many causes of that, of which veins can only is one of the potential causes, but all the way from congestive heart failure problems to medications to veins can all cause swelling in the legs. And if you're having that kind of difficulty with swelling in the legs, I'd actually recommend highly that you see your primary care doctor so they can kind of get to the bottom of it, because there's many causes, and veins are just one of them.
Okay, let's get John on real quickly. Got about 2 minutes. John, what's on your mind?
Hi, yes. How does the camera get that 3D image? Is it on the tips of the instrument where inside the body, or is it like a infrared kind of a thing? It's
on the tip of the camera. That's at the bottom of it. It's proprietary stuff that the Da Vinci folks have worked on, and it truly is 3D. I mean, when you're in there, it's like you're right inside.
Well, it would have to be.
So is it a sonar, or how are you getting images underneath the skin level?
Oh, so we have tubes inside of the belly. So we put the tubes inside, and through those tubes we put our instrumentation and the camera. So the camera is, when I'm looking at it across the room, I'm seeing what that camera, and I can control the camera to go wherever I want, and I can control my instruments to go wherever I want. And so you get this 3D image of everything.
So as long as the camera isn't doing damage moving around, you get a much better perspective on whether, for instance, your stitches from the inside are effective and all that. I can see how that would be really useful.
Yeah, exactly.
Okay.
All right,
Thank you.
Thanks for the call. We have exactly 1 minute left. So
you've got 100 hernia surgeries under your belt with the robot, right?
And that's where hernias are under the belt usually.
So are you gonna be going? Are you gonna be doing new types of surgeries, or getting a new robot, or what?
Well, it would be very nice if we got a new robot. We're working at that, trying to get to that, but we're getting to the place where we may need another one. Our crew over there actually does a great job in working with that. So I just wanted to sit there and again just reiterate how great those folks are.
Real quick question. Last caller wants to know, how do you keep the camera lens clean in there?
Well, it actually has this method of staying clean on its own, but it does get moisture on it, or sometimes something else on it, and so we have the tech can actually pull it out and clean it up very easily.
And we're out of time. Doc, thanks so much.
You betcha.
Dr. Tim Richards with Health Talk, always fascinating guest, and we will continue with an hour of open phones with Talk Back coming right up.